Yes, you're welcome. This is your boy Jacob. Now, today we are going to talk about East African countries with the best healthcare system. Now, in East Africa, we have 5 countries, and we are going to talk about the healthcare system of all these 5 countries, ranking from number 5 down to number 1. Now, if you are new to my channel, just consider subscribing to my channel. Now, number 5, basically we have Burundi. Now, Burundi is one of the smallest countries in East Africa. It suffered a lot during the times of civil war from 1993 down to the year 2000. But ever since that, basically it's struggling, but they are trying to improve it slowly. Now, their healthcare system is made up of both the private sector and the public sector. Now, they have 3 regional hospitals, 15 provincial hospitals, 33 district hospitals, and 509 health centers. Currently, they are still creating more hospitals to improve their health system. With the help of organizations like USAID, they are improving their health system slowly. The USAID helps to support them in HIV/AIDS, child and maternal health. They are improving on the infrastructure, staffing, and training specialists overall. Then in number 4, we have Uganda. Uganda's health system is made of both the private sector and the public sector. The private sector is made of private not-for-profit, then private for-profit hospital. Then the public sector depends on a referral system where they refer patients from the lower centers up to the national referral hospital. Now, Uganda has a total of 6,937 health facilities, which are made up of 5 super specialized hospitals, 5 national referral hospitals, 14 regional referral hospitals, 139 general hospitals, and very many health centers. Now, in all the kind of care in the private sector, you have to pay for it, but the health care in the public sector is free of charge. Now, they are improving on their infrastructures, are building more health centers to accommodate all the people. They are also training more specialists to handle more of specialized care in the hospitals. Then in number 3, we have Tanzania. Now, Tanzania is the biggest country in East Africa. The healthcare system in Tanzania is divided in both the private and the public health system. They have a kind of pyramidal kind of system where patients are referred from a dispensary level up to the consultancy hospitals. Now, what makes Tanzania slightly better than Uganda and Burundi is they have a health insurance. At least 32% of the whole population of Tanzania is insured. Now, they have 4 insurances: the national health insurance, the social health insurance, the community health fund insurance, then the private insurance scheme. Now, the national health insurance basically caters for public servants and their spouses. Then the social health insurance benefits people who are serving with NSSF. Then they have a community health insurance which basically targets the rural people in the local population, basically in the villages. Then they have private health insurance. Basically, this one individuals have to pay, and these are organizations like Jubilee, AAR, and the Resolution Health. So basically, they have 4 insurance companies, and these ones in total give most people, like at least 32% of the people in Tanzania are insured. On top of that, they are building more hospitals and also training more doctors to become specialized and treat specialized illnesses. Now, in number 2, we have Rwanda. Rwanda, like Burundi, is one of the smallest countries in East Africa. It suffered a lot in the time of genocide around 1994, but after that, their health system improved drastically, and nowadays it ranks in whole of Africa as one of those countries with the best healthcare system. Now, their healthcare system, like other countries, is divided of both the private sector and the public sector. They have a total of 499 health centers, and 4 national referral hospitals. But what makes Rwanda very unique from all other East African countries and the rest of Africa is the national health insurance. Rwanda has a national health insurance, and 97% of the people in Rwanda have insurance. That is very good. Now all of the people in Rwanda, 97%, can get treatment for free because of their national health insurance. That is very good. There is no other East African country which has this. This is a very big positive for Rwanda. On top of that, they have improved on the infrastructure in hospitals, the staffing, the specialists, and also their salaries are very competitive for health workers. Now in number 1 we have Kenya. Kenya is the East African country with the best healthcare system in East Africa. It has both the private and the public sector. Their public sector depends on a referral system where patients are referred from the lower centers, the dispensaries, up to the national hospitals. But what makes the difference with Kenya is the private sector. They have a very competitive private sector, which is almost the best in East Africa, offering quality care with highly specialized care, which is very competitive in the whole of Africa. Their hospitals like 𝐵𝐷𝐾 offer very good care, and it has become a regional of excellence, providing a highly specialized care which all other East African countries come seeking for. Now, instead of people going to South Africa, India, all of them are flocking to Kenya to receive this kind of specialized care. They offer services like IVF, kidney transplant, which is very good, and Kenya receives around 300 to 500 foreigners seeking that kind of quality care in Kenya. So this private sector, which is very good although expensive, makes Kenya stand out as the best country in East Africa with the best healthcare system. Yeah, so that is my tutorial of the countries with the best healthcare systems here in East Africa.